Hey, you with the tight hips, you ready to learn how to do a hip car? Well, what the heck is a hip car? Well, it's a really good assessment and mobility exercise you can do to loosen your hips and try to find where you need the most mobility within your hip joint. So CAR stands for Controlled Articular Rotations. These are concepts based off of FRC. And I love their moves because, well, they help as an assessment as a clinician, but also I can give this to patients as a take-home exercise to work on their hip mobility. So to be able to perform this exercise safely and effectively, you want either a stick, broom, or hold on to a countertop wall, whatever you have near you, because we're going to be on one leg for this exercise. And doing a controlled articular rotation, we want to work through the full range of the motion. So for a quick biomechanics lesson, what ranges of motion does the hip move through? Well, first, it moves through flexion and extension. That's where a lot of our gait pattern or walking pattern comes from. It also does adduction or coming towards your midline, or abduction or going away from your midline, along with rotation. So we have external and internal rotation. So with a hip car, we're going to go through all these ranges of motion. I'm going to grab my stick and we're going to do what we call irradiate the body. I like to just think like I'm 5 years old again and I'm going to throw a tantrum, so I kind of contract my whole body. When you got a good contraction through your whole body, maybe 20 to 30% of a max contraction. So after I got my full contraction, I'm going to start bringing my hip up into flexion. I'm going to go into some external rotation and adduction. And as I come up, I go into my end range and flexion, slowly move my hip into abduction, then internal rotation, really try not to move any other part of my body but my hip, bring it back into that extension, and then back into that neutral. And that was hard enough, but that was only half a rep, so we got to go backwards now. So now I'm going to irradiate, kick back as far as I can, come up into that abduction range. I feel like I'm going to cramp here, bring it back into flexion, back into that external rotation, bring it back down, back to neutral, and that was one rep. I'm going to irradiate, contract, find my balance. I'm going to come into some of that external rotation, bring it up into flexion, run out of real estate, start to bring it into that abduction and internal rotation, really carving out as much range as possible while maintaining that contraction, bring it back to neutral. That's half a rep as mentioned. So now we're going to kick back, really keeping a neutral spine the best you can, carving out as much of that hip range as possible, bring it back down. And I've only done one rep on each side, but I'm feeling looser already. Now these are good mobility exercises to work full ranges of motion, but you can also use these movements as an assessment. So as I'm going through the ranges of motion, I'm also checking where I have the most tension. So for me, I get a lot of tension either on the back side of this hip when I'm coming into that abduction. So now when I do other mobility drills, I'm going to target that area of my hip specifically so I can start to clean up my overall range of motion. And that's how to do a standing hip car. If you want me to show you more of these controlled articular rotations, well, comment below what you want to see next. And if you want to see some more hip stretches or exercises, give this video a like, obviously subscribe, hit the bell notification so you know when new content's coming out. Pacha!